Hello everyone, welcome back to our channel. In this video, we will see an important topic, arches of the foot, which will be asked as an essay in the lower limb. So arches of the foot, it's slightly a difficult topic, but if you understand it better, it will be an interesting topic. Those who have not subscribed to the channel, do subscribe now. Keep watching the videos. Now we will move on to the topic, arches of the foot. So what are the functions of the human foot? Human foot serves the two functions. The main function is this, supports the weight of the body. So supports the weight of the body. It's an important function in the human foot. You can appreciate equal weight distribution in the foot, both in the front and in the behind. So human foot supports the weight of the body. So if you see the functions of the arches of the foot, why we have arches of the foot? Can you think for a while why we should have the arches of the foot? We will now see. So it's proportional distribution of the body weight. So this arched nature distributes the body weight both front and in the behind. And already we have seen, because of this arches, it acts as a segmented lever. That is very important in the propulsion of the foot. Thus, concavity of the arches protects the plantar nerves and vessels from compression while we walk, run. So that if you compare this, if we have the flat foot, it will not be dynamic and as pliable as this arched foot. So this invertor and evertor muscles of the foot also have one function, shift of weight distribution among the heads of the metatarsals. So when you invert and evert, this weight distribution in the heads of the metatarsals also is distributed. So these are the main functions of the arches of the foot. We have both longitudinal arch and transverse arch in the foot. So this first we will start with the longitudinal arch. We have two longitudinal arches. So you take one foot, it is longitudinally arched both medially and laterally. So the medial arch will be called as medial longitudinal arch and lateral longitudinal arch. So in each arch, what are the features of the arch and what are the factors that maintain the arch, we have to know. It may be asked as separate question, short notes, medial longitudinal arch, lateral longitudinal arch. How you have to present is first features, and second important feature is factors which help in this support of the arch. That is the way you have to present the answer. What are the features of the medial longitudinal arch? We will see. So for each arch, what is the feature is, what is its shape? If you see this medial longitudinal arch, it is a big arc of a small circle. Otherwise, it is highly arched like this. So it is a big arc of a small circle. So the summit of the arch lies at a higher level than the lateral longitudinal. So now we are comparing both longitudinal arches, medial and lateral. So naturally it is in the shape, so bones of the arches lie at a higher level than the lateral longitudinal arch. So you can appreciate this is the medial longitudinal arch what we are describing. So these are the bones of the medial longitudinal arch. So bones of the medial longitudinal arch, these are the bones. It is the big arc of a small circle. Bones of these arches lie at a higher level. So what are the bones? Can you identify? So this is calcaneus, talus, navicular, cuneiform, heads of the metatarsals. These are the heads of the metatarsal. So the arches from this up to this heads only, not to the phalanges. So this is the medial longitudinal arch. So this is the highest point of the arch. So what is the highest point? upper trochlear surface of the talus. So we have seen the bones forming the medial longitudinal arch in the previous picture. They are the calcaneus, talus, navicular, three cuneiform bones, and medial three metatarsal bones up to their heads. So they include the two sesamoid bones which are beneath the first metatarsal head also. These are the bones which form the medial longitudinal arch. So the features, first we have to say what is the shape and what are the bones which form the arch. Now what is the summit of the arch? In the picture I have shown you the summit or the highest point of the arch is the trochlear upper surface of the talus. So what is that? Trochlear upper surface of the talus will form which joint have you thought? So the trochlear upper surface of the talus is the articulating surface of the ankle joint. Then we have to tell posterior pillar and anterior pillar. So for any arch, we should have two pillars, front and behind. So what is the posterior pillar is medial tubercle of the calcaneus. And what is the anterior pillar? Anterior pillar is the heads of the three metatarsal bones. So posterior pillar will be the common for both medial and lateral longitudinal arch. So this is how we have seen this is the posterior pillar, medial tubercle of calcaneus. This is the anterior pillar. So the arch has a one higher point and two supporting points behind and front. So this is called as summit. This is what we were telling. This is the articular surface of the talus, which is the ankle joint. And this is the posterior pillar and this is the anterior pillar. So the next feature we have to tell is which is the most vulnerable part of any arch. Otherwise, if that point is broken or if that surface is, if that part of the arch is affected, then the arch will be flattened. So that is for each longitudinal arch we have vulnerable part. So here it is represented by the head of the talus, that is the vulnerable part of the medial arch, head of the talus, that is the keystone. So you should think that for any arch you should put one part or one stone in the highermost point, that is the keystone. Then it should be supported by the two pillars, anterior pillar and posterior pillar. So now here is the keystone is head of the talus. So that is the which is acting as a keystone which is received in front by the concave surface of the navicular bone and below by the sustentaculum tali of the calcaneus and by the spring ligament between them. So if you see this arch is compared to the, so we are comparing both longitudinal arches from first. This arch is formed by more bones and more joints. So this resiliency is the characteristic of this medial longitudinal arch. Lateral longitudinal arch, it represents the small arc of a big circle. So now if you draw the lateral longitudinal arch compared to the medial longitudinal arch, it represents this small arc of a big circle. So if you draw again in comparison to this is how the medial longitudinal arch was present, and this is medial longitudinal arch and this is the lateral longitudinal arch. So what are the following bones from behind forwards? You can see it is less bones compared to the medial longitudinal arch. Calcaneus, cuboid, 4th and 5th metatarsal bones up to their heads. Again you can see this calcaneus is coming for both medial and lateral longitudinal arches. So again, what is the summit of the arch? Lies at the subtalar joint. Medial longitudinal arch is the upper surface of the talus. Here this is at the subtalar. So that ankle joint is the summit of the medial longitudinal arch. Subtalar joint is the summit of the lateral longitudinal arch. So here the summit is lower than compared to the medial longitudinal arch. Posterior pillar is common for both arches, medial tubercle of calcaneus. Anterior pillar is formed by the heads of the fourth and fifth metatarsal bones. So now you can see this is the posterior pillar and this is the anterior pillar. So this is the lateral longitudinal arch. So that is the small arc of a big circle. And the upper part of this upper summit of this lateral longitudinal arch is this subtalar joint. If you see, this is the summit of the medial longitudinal arch and this is the summit of the lateral longitudinal arch. So you can appreciate because these bones, calcaneus, navicular, these are the bones of the medial arch. Here the lateral arch only calcaneus, cuboid, fourth and fifth metatarsal bones. So what is the most vulnerable part of this lateral longitudinal arch is calcaneocuboid joint. So here less number of bones, less joints, rigidity is the characteristic of this arch. So we can see, so this is the vulnerable part, that is the calcaneocuboid joint. This is the calcaneocuboid joint. Vulnerable part of the medial longitudinal arch is this part. Now we have completed the longitudinal arches. Now start with the transverse arches. Transverse, this is, you have to understand, longitudinal arch is present in each foot to medial and lateral longitudinal arch. Now this transverse arches, each foot represents half of a transverse arch. So if you join two feet together, we have the one single transverse arch. So each foot represents a half dome with a concavity directed medially. So this is how, when you keep both feet together, we get one transverse arch. Transverse arch consists of a series of arches which involve, so you can say, metatarsal bones forms one transverse arch. Cuboid and three cuneiform bones form one transverse arch. All metatarsal heads do not take part in the transverse arches. So that is again the difference here in the transverse arch, bases of metatarsals. In the longitudinal arches, heads of the metatarsals. So that is the difference between this medial and the lateral longitudinal arches. So now again we have to see the features of this medial arch and the transverse arches. Then we have to compare what are the highest point in this transverse arch, what are the supporting features for each arches. So if you see this transverse arches or longitudinal arches, what are the supports? So you have to understand. So for example, if you are bridging some structure with this arch in nature, you consider these are the stones. These are each stones. So how to construct these arches? So we have to have one upper part or summit, which is the keystone we have to keep in the arches. And this small stones together should be tied by cement like this. They will be called, otherwise called as staples. So you have to tie all the bones together by small structures that will be called as the staples or intersegmental ties. Again, you have to tie this. If you think this is the anterior pillar and this is the posterior pillar, you have to tie both the ends together. In the childhood, you should have done a bow with a stick. So how will you tie both ends? You will tie one thread. So like this, here also anterior pillar and posterior pillar should be tied. So the structures which extend from the anterior to posterior part in the sole of the foot, they will act as the tie beam. Again, you have to give one support for the keystone from above. So that will be called as suspension. Otherwise, the structures which come and attach from the dorsum of the foot to the sole of the foot, they will be acting as a suspension. So we are holding the arch from above. So they are called as suspension or sustentacular movements or sustentacular supports for the arches of the foot. So now you have understood what are the factors we have to tell for each arches. We have to tell which is the keystone, which is the stapler or intersegmental ties, and tie beam. So you have to differentiate. Intersegmental ties are this small bridges, small part which is bridging the stone. But tie beam is tying both ends together. Again, suspension and sustentacular. So this is how we are going to see now the supports of the arches of the foot. Factors maintaining the arches of the foot: maintenance of medial longitudinal arches. So shape of the bone is very important. Shape of the stone or bone in constructing, that is very important. Here the bones are wedge shaped with a thin edge directed to the plantar surface. So the rounded head of the talus is the keystone in the medial longitudinal arch. Intersegmental tires, so like metal staples or so many plantar ligaments tie these bones. So that is the intersegmental tires. Important ligament is the spring ligament. So you can see this is the spring ligament. Spring ligament may be asked as short notes for you. So these are the spring ligament. So this is the plantar calcaneonavicular ligament. So that is again called as spring ligament, which supports. So this is the medial arch. So this is the spring ligament which are holding the bones together on the medial side. So they are called as tie beam. They are called as intersegmental ties, not tie beams. So what are tie beams? Extending from anterior to posterior, you can easily understand the muscles and the aponeurosis in the medial side, in the first layer and in the second layer or in the third layer of the sole of the foot, tying from. So if you think this is calcaneus and this is first metatarsal, whatever structure which are extending muscles or ligaments or aponeurosis from one end to other end, they will be called as tie beams. So what are suspending the arch from above? Now what is holding this medial longitudinal arch? Tendon of tibialis anterior. That's what I told. This tibialis anterior is present in the anterior compartment of the leg and in the dorsum of the foot. So that supports the arch from above. So these are the four factors which support the medial longitudinal arch, which we have seen in detail. So what are the factors? Intersegmental tires, keystone, then the tie beams and also the suspending from above. The sustentacular is tibialis posterior, hold all the bones of this medial arch. So it like supporting from below one tendon, that is called as the sustentacular action. So now what I have told this is the medial longitudinal arch, this is the heads of the metatarsal and this is the calcaneus. So all this palmar aponeurosis, plantar aponeurosis is cut. So the plantar aponeurosis is one tie beam. Abductor hallucis muscle in the first layer, flexor hallucis brevis, flexor hallucis longus tendon. All these form the tie beam for the medial longitudinal arch. So again here in this you have been asked, shown the spring ligament or plantar calcaneonavicular ligament. So this is the plantar calcaneonavicular ligament. So they are the tires, intersegmental tires or staples in the medial longitudinal arch. Lateral longitudinal arch, again factors which support the lateral longitudinal arch we will see. Shape of the bones, a triangular projection of bone, calcanean angle of cuboid. This bony projection, that is very important. Intersegmental tires on the lateral side are the long and short plantar ligaments. So this is how we have seen, this is the spring ligament on the medial side. On the lateral side, if you see, long plantar ligament. So this is the long plantar ligament. And here underneath the long plantar ligament, we have the short plantar ligament. To understand all these ligaments, you have to see inversion and eversion video in our channel, which covers all this mid-tarsal joints, which help in the inversion and eversion. So all these ligaments will be dealt in detail in that topic. So this is the long plantar ligament and spring ligament is removed partially so that we are able to see the short plantar ligament. Factors acting as tie beam on the lateral side. Same plantar aponeurosis, but here lateral part, abductor digiti minimi, lateral part of flexor digitorum brevis, flexor digiti minimi brevis. Acting from above, so tendons of peroneus brevis and tertius. Brevis will be in the anterior compartment of the leg. Brevis will be present in the lateral compartment of the leg, and tertius will be present in the anterior compartment. So they expert the sling from above. The tendon of peroneus longus, which is from lateral compartment but comes for insertion in the sole of the foot, it maintains the lateral arch of the foot by the sustentacular action. So same like the medial longitudinal arch, we have to tell the same points. So if you are asked as short notes now, you should have understood how to present each arches separately. So maintenance of transverse arches, same factors which maintain the medial arches and lateral longitudinal arches, same will come. Shape of the bone is wedge-shaped cuneiform bones and bases of 3 metatarsal bones. Intersegmental tires, we have to remember other small plantar ligaments, dorsal interosseous and oblique and transverse heads of the adductor hallucis. Acting as tie beam. So acting as tie beam, peroneus longus and tibialis posterior. Acting from above, tendons of peroneus tertius and brevis on lateral side, tibialis anterior on medial side. To understand all this, you should know the insertion of these tendons thoroughly. Then only you can appreciate how they are acting from above or acting from below. In fact, now what I have told still now, the factors which maintain the longitudinal arches maintain the transverse arch. We have completed in detail the medial and the lateral longitudinal arches. Now what are the deformities of these arches of the foot? It will be called as flat foot or pes planus. So this is disappearance of the medial longitudinal arch mainly. The cause is sudden gain in the weight or faulty standing habits or faulty shoe wearing also causes this flat foot. Pes cavus, it is an exaggeration of the longitudinal arch. So when this patient walks with this pes cavus, we have the toes are dorsiflexed at the metatarsophalangeal joints and plantar flexed at the interphalangeal joints. So we have learned what are the deformities, pes cavus and pes planus. So now we have come to the summary of the arches of the foot. Foot is arched both longitudinally and transversely. Longitudinal arches both medial and lateral. The bones forming the arches are the calcaneus, talus, navicular, 3 cuneiform and medial 3 metatarsals up to their heads. Main factor in this arch is the plantar calcaneo-navicular ligament. Lateral longitudinal arch calcaneus, cuboid and lateral 2 metatarsals. Main factor in this arch is the long and short plantar ligaments. So we have covered in detail the arches of the foot. I hope you should have understood this topic in detail, which is an important essay or maybe asked as short notes. 3 short notes: medial longitudinal arch, lateral longitudinal arch and transverse arches. Even the clinical question may be asked as pes cavus or pes planus. The next topic in the lower limb we will see in the next video. Those who have not subscribed to the channel, do subscribe now for the updates in the videos. Do subscribe now. Keep watching the videos. Thank you.